Good afternoon, everyone. This is Matt Ring with Nationwide. Thank you for joining us again in what's becoming a webinar series over the last few years between Nationwide and ISAC. For those of you who don't know, Nationwide is a 457B deferred compensation provider endorsed by NACO and endorsed by ISAC here in the state, and I am the representative here in the state servicing all of the counties who use the NACO deferred compensation plan. Today with us we have Dave Harris from the Nationwide Retirement Institute. Some of you may recall that Dave provided a presentation at the fall school last year covering Social Security benefits, and today, in partnership somewhat with that presentation, Dave's going to be talking about healthcare costs and how they may affect your retirement. So with that, I'll hand things over to Dave, and if you have any questions during the presentation, please let us know, and Rachel will be moderating those questions as they come in. Thanks again.
Matt, can you hear me okay?
Yes, sir.
Wonderful. Well, thank you very much, Matt, Rachel, for putting this together and allowing me to be a part of it. And thank you all who have taken the time out of their day to join us and talk a little bit about retirement, and really talking specifically about healthcare and healthcare cost in retirement. So one of the things that I do every time I give this presentation, I start it really the same way. I've been with Nationwide now 20 years. For the past 10 years, I've been working with the Nationwide Retirement Institute. My love for retirement income planning started before I got the job. It actually started for me back in 1999. I came from a really small family in Ohio. It was my parents and myself. They gave me a really good start in life, and I found out at the beginning of 1999 they were going to retire at the end of 1999. So I knew about investing. I was in the business of investing. I had studied investments in college. So since my parents gave me a good start in life, I wanted to give them a good start in their retirement. So what I did over the course of about 4 months is study as much as I could on this whole concept of retiring and retirement income planning. And as I went through that process, I learned quite a bit, took a lot of notes, and put together a 3-ring, 2-inch binder with all these ideas that I could share with my parents. So in September of 1999, I asked them to get some time so we could get together, have lunch, and just kind of talk through some ideas about their retirement, just to make sure that they were prepared. Well, as we sat down and we had lunch, I realized the only word of that invitation that they heard was lunch, because as I started going through this idea of retirement, they felt fine, and they really didn't feel that they needed a conversation around it. They felt they had all of their ducks in a row, and they just wanted to enjoy some time together and enjoy lunch. So after 4 months of work, that whole bit of effort gets boiled down to let's have lunch, and it was a little disappointing. But you know, one of the things that I learned is that my parents had done some work and some research, and they were prepared to retire, so they did. Well, the issue that they ran into is that the world kind of changed in the financial side back in 2000. We had a tech bubble burst, and a lot of accounts lost some pretty significant value. That unfortunately happened at a time for my parents that they were pulling money out of those accounts and ended up putting them in a situation that by 2004 they had spent about 43% of the money they saved for retirement. So in less than 5 years, they were close to 50% drained on their accounts. At this point in time, they do come to me and tell me the situation, and I said, you know what, we better have lunch again, and let's talk through this. So we do. We sit down, we start working through it, and one of the first questions I ask them is, could I take a look at your budget? They didn't really have a budget. So my first job was to help my parents create a budget, and it was challenging. Well, we get the budget in place, we get the spending on track, and we get them back on track for retirement. And then we were thrown another curveball. My dad worked for GM for 48 years. He was an engineer. So what ended up happening is when GM in 2008 restructured, he and everybody in his plant and really across the U.S. that were salaried employees, they lost their health care benefits that they were promised through retirement. So we're in a situation in 2008 where we now know that we're going to have to go to Medicare and really get a good understanding of what health care is going to look like from the Medicare side, from supplements and all the different parts of Medicare. So we end up going and doing a lot of research together. And one of the things that I was able to find is a lot of different good information around Medicare and what's available, but I could not find anything that would give me a very good understanding of the expense and something that would help me be able to put some numbers into a budget to be able to help my parents make sure that we stayed on track. Nationwide in 2010 took some of the challenges that I was sharing with them as far as some of the things that I was working with my parents and lack of knowledge that I was able to gain by going out and doing some research around healthcare cost. And they created this program. So I thank the people in our Nationwide Retirement Institute for going out and doing a lot of the research and actually building a calculator that you all can use. So, Matt, I'm just going to go through the agenda really quick, and we're going to go ahead and get started. We're going to cover really two things today on the call. First thing we're going to talk about is healthcare and retirement, what that is. So we're going to spend our time getting familiar with the different parts of Medicare. And the second thing we're going to do is we're going to talk about a calculator that you have access to that's going to help you be able to estimate what your health care cost will be specific to you. So your health, your savings, where you live, your age. It's going to give you very good detailed information specific to you. So starting off, one of the things that a lot of people don't know is that healthcare will be one of the largest expenses that most people will face during their retirement years. The research says if you look across America and you average out all the expenses that everybody has as far as looking at overall how people spend their money in retirement, healthcare costs will come in second only to total household expense. Now, when I say total household expense, I mean mortgage, taxes, insurance. I also mean things like your utilities. So all of that combined is the first largest expense. The second largest expense is going to be healthcare cost and retirement. With so few people understanding that, we thought that we had to go out and make sure that they had a little bit more information around what this means. So, Matt, if we could, let's go to the next slide. We found that as we were doing the research, especially myself trying to figure this out for my parents, I found out how complex Medicare really is. It has a lot of moving parts, a lot of different pieces. And with that, it does make it a little challenging to learn, let alone to try to estimate what an expense is going to look like. A lot of people underestimate these expenses, especially long-term. And many times, if you look at women with the longer life expectancy, which women do have longer life expectancies than men, you find that many times they underestimate that expense, and that can be challenging. We found that really 4 out of 5 people underestimate the expense if they include healthcare costs at all in their planning for how they're going to spend their money during their retirement years. One of the things that you need to understand when you look at how your money is going to be spent during the retirement years, it's a strategy that a lot of people have bought into, and it's referred to as the go-go, the slow-go, and the no-go years. So if you're going to have a 30-year retirement, the thought is those first 10 years you're going to be going and having a lot of fun. You're going to be spending money on trips and different things. And then you're going to get to the slow-go years in those next 10 years. And that's where things just kind of slow down a bit. You may not be traveling as often or as far. You're probably not going to be buying as much new clothes because you're not wearing your clothes out as often since you're not as active. One of the things I noticed with my parents is they got into that slow-down period. Instead of eating 3 meals a day, they really only ate 2 meals a day. It's just because they really weren't so active, so they weren't burning off the calories, so it was something that that's where their comfort zone was, and that's where they focused was just 2 meals a day. So there's a reality when you do that slowdown that there will be a reduction in spending a lot of times. The issue, though, is that sometimes people think about the no-go years and think that that's going to be the least expensive because you're really not going anywhere. This means that your health may be having a harder time or you're just not able physically to travel. so a lot of times people think that expense is going to go down even further, but the reality is usually by that point in time, healthcare cost and maybe long-term care expense can start driving the income that you're going to need back up. So when you look at spending patterns in retirement, a lot of times you start off spending a little bit more because you have more time on your hands. So those go-go years, you are spending more than what you're normally going to spend in retirement. The slow-go years is kind of that dip in your overall spending, but the no-go years, you kind of see that you going back up as the expense starts to increase for healthcare. One of the things that a lot of people don't understand is that the average healthcare for somebody in retirement, the average cost of living adjustment every year or inflation rate is around 6%. And that's not including usage. So if you go out and you are looking at just what the increase would be from the side of how much your premiums or deductibles or copays would be going up, that's about 6% a year on the average. But when you start to think about those slow-go and those no-go years, as the health starts to become an issue, you're not only going to see the 6% on the different premiums, deductibles, and copays, but you're going to now be using that insurance more, meaning the cost is going to be going up because of the usage. So it's one of the things we always like to talk to people about before they get into retirement, so we can give them an idea of how healthcare cost will impact their retirement. We don't want people to get lulled into this false sense of security when they retire and see the numbers that they're paying that first year, because if you think about it, for most people, that first year in retirement, those first few years in retirement, that's probably going to be when you're the healthiest. So, Matt, if we could, let's go ahead and start talking a little bit about Medicare. And before we click on anything, I'm going to need you to click twice here, Matt. But before we do that, I just want to talk about how you become eligible for Medicare. So as long as you have paid into the Medicare system for at least 10 years, you now are eligible to sign up for Medicare when you turn 65. And the way Medicare looks at this is there's going to be a period of time that you're entitled to do your initial enrollment. So this is your first introduction to Medicare, and it's all going to be happening right around your 65th birthday. So if you think the month that you were born, if you think 3 months before, 3 months after, plus the month that you were born, there's 7 months that you actually have a chance to go out and do that initial enrollment. When you're looking to enroll, what will happen is you will have two different options. There's no way to combine these two into one solution. You're either going to choose option 1 in that path or option 2 in that path. And what I'd like to do on this slide before we move on is I want to give you a good understanding at a high level about these two. I'm going to go a little bit more into depth on the option 2, the Medicare Advantage, on this slide. And then what we're going to do is we're going to go through the other side, the option 1, over the next few slides, where we really get into that traditional Medicare and all the different moving parts and pieces. So if you look at option 1, starting off at a high level, this is that original or that traditional Medicare. It's designed, and what you have is 2 parts. You have Medicare Part A for hospitalization and Medicare Part B for, it's basically doctor visits and outpatient procedures. So what happened was, as more procedures were done and as hospital bills were going up, what people found out is that they ended up having some larger copays and deductibles for these services than what they really wanted to take on. So this created this secondary insurance market. And what this is going to be some ways to cover the expenses left behind with Medicare Part A and Medicare Part B. And there are really 2 ways under this first option that you can have those expenses covered. This GHI, all GHI means is group health insurance plan. So when you think about the story that I told you at the beginning about my dad losing his health care benefits from GM, that was a group health insurance plan from General Motors. When they cut that plan, he had to decide what he was going to do, and what he chose was a Medigap supplemental plan. So that where it says Med Sup, that's just the Medigap supplemental plans. There are 10 plans. They are identical in what they cover, state to state, county to county across the U.S. Their costs can change county to county, but the coverage does not. Medicare mandates what that coverage will look like, and any insurance company that wants to sell that policy, they have to live up 100% to what Medicare does as far as an outline for each one of those 10 plans. Some of those plans are very inexpensive. Some of those plans are much more expensive. So there are high deductible plans and there are more all-inclusive plans. And we're going to talk a little bit about those as we go through the presentation. This leaves one last part under this option one, and that's RX coverage or pharmaceutical coverage. Again, two ways that you can cover that. You could cover that under a group health insurance plan like my dad did for years under GM, or you could go out and you could buy a Medicare Part D plan. These plans are offered by independent insurance companies, and they are offered for profit. The insurance companies are the ones that create those plans. They actually set the list of pharmaceuticals that they cover and how much they cover. And those plans will change in cost, coverage, and availability county to county across the U.S. It's not even a state thing. It is most definitely, it is a county choice as far as what insurance companies want to offer in each one of these different counties across the U.S. And again, it's the cost, the coverage, and the availability that will change. So if you put all of these pieces together under this option one, you have pretty good healthcare coverage during your retirement years. The only things that are left out, there are three things that are left out: hearing, vision, and dental. Those are three different things that are not covered under option one in any way. So many times either people will go and they will buy a policy or policies that will cover those three. One interesting thing that I found, there are these huge like warehouse stores like Costco. Close to where I live, we have a Costco, and over the course of a couple years, I saw some of their services growing. One of them was a vision center. It continued to grow, and then they added a hearing center about 2 years ago to my Costco. So I was wondering, I wonder if that's directed at people that don't have that coverage under Medicare. And I found out that in my case, at least at my Costco, it was. In addition, they also had different dentist offices around the area that I live that would accept members and give them a discount. So there are ways that can be covered either independently through policies that people could buy outside of Medicare, or it could be covered in other ways, just paying out of pocket. Many times there are ways to reduce that expense. Now again, here in a couple minutes, we're going to talk through these different parts of Medicare, because especially Medicare Part A and Medicare Part B, it's good to get an understanding on how those work. Now the next thing that we want to take a look at before we do move on is the second option that you're entitled to. And these are the Medicare Advantage plans or Medicare Part C. These plans operate like plans that most of us had during our working years. They're considered HMOs or PPO plans, and all that means is that they're managed care. You have a network of hospitals, doctors, and maybe pharmacies, and as long as you stay within that network and play by the rules, you have a known expense. Many times that can bring the expense down on a monthly basis and when you use it. Now, the one thing we have to note about these Advantage plans is, again, these are created, operated, and controlled entirely by an insurance company. So the insurance companies, they're operating these for profit, and the insurance companies will differ these plans in cost, coverage, and availability county to county across the U.S. So you may be in one county and a neighboring county may have a plan that your county does not have. These plans can and many times will change year over year. So there's an open enrollment period. Once you've signed up for Medicare, you've gone through your initial enrollment, every year, the second week in October through the first week of December, what you're going to find is that is open enrollment for Medicare. So every year during that open enrollment, the insurance companies that offer the Medicare Advantage plans, they will disclose the plans that they're going to offer for the next year. So they will offer those up, and it may be the same plan or a similar plan that you had the year before, the current year, or that plan may be going away and you may need to make a different choice. Now, one thing that we find that people do like a lot about the Advantage plans is many times these Advantage plans will include hearing, vision, and dental within their overall plan. So one of the things that I would always recommend is a state agency, and every state has them, and there's actually an office for every county across the U.S. Now, it's not a one-to-one relationship where every county has an office located in it, but every county has an office that they can utilize that specializes in their county, and maybe a few others. And it's the State Health Insurance Programs Office, the SHIP office, as many times it's referred to. Now, with my job with Nationwide, when I started 10 years ago, I covered 48 states. I'm now down to only covering 8, and really mostly the Midwest. I've worked with 11 different SHIP offices with my time in doing this, and I've had wonderful experiences each time. They don't sell products, and they can't really make a recommendation on exactly what you should buy, but they can give you pros and cons and help you understand what is available to you. And if you're going back because maybe the Advantage plan you used is no longer available, they can help you see what is currently available in your area. So they're a wonderful, wonderful resource. Now, when you look at these two plans, one question that I get very often is, can you move once you've signed up? So say your first year you signed up for the Advantage plan, but down the road, you want to switch over to the option 1. The answer is maybe, and here's why. Medicare reserves the right that after a period of time, if you're on, say, the Advantage plan and want to switch over to the traditional Medicare with using something like a Medigap Supplemental plan and a Medicare Part D, they reserve the right to do something that they cannot do when you initially sign up. When you initially sign up for Medicare, they cannot look at your history as far as your health, so pre-existing conditions are not included. They can't make you take go out and actually have medical stuff run where you get basically a checkup and they understand what your health is like. So they can't do that either. They can only take into consideration where you live and then the age that you are. That is what they can base your health care on, but they can't look at anything else. If you're going to make the switch from, say, option 2 to option 1 down the road, they do reserve the right to have you go take a physical to see how you're, they can see all of your records as far as what pre-existing conditions you have. And at this point in time, they can choose to charge you more, or they can choose to not allow you to have that coverage under option 1, meaning that you would stay with option 2. It doesn't mean you lose your coverage, but it means you cannot make that change. So it's one of the things that I always say when you're looking at doing this. I always look at both of these very closely and make the decision that you feel is right for you, with the idea that maybe you won't be able to make this change down the road. Now, what I'd like to do over the next couple minutes is actually go through the different parts of this traditional Medicare, because there are a lot of moving parts, and to have a good understanding of these parts is really, it's vital. So the very first part is Medicare Part A. Medicare Part A is that hospitalization insurance. So it's going to cover things like inpatient hospitalization, skilled nursing and home health care for rehabilitation purposes only, and then hospice for end-of-life comfort. The great thing about Medicare Part A is that if you have paid into the Medicare system for at least 10 years, you have paid all the premiums you need to pay to have this insurance when you reach 65. Now, obviously, many of us are going to pay in for longer than 10 years, but 10 years is the bare minimum. So as long as you've made those payments, or a spouse has made those payments in for those 10 years, Medicare Part A will not cost you a dime to have, but it will have an expense when you use it. In this case, if you were going to the hospital this year and you were put in as an inpatient, the very first $1,316 is going to be your responsibility. Now, if you only have Medicare Part A and Medicare Part B, that $1,316 is going to have to be covered by you. If you have an Advantage plan or if you have a Medigap Supplemental plan, many times that will cover all or most of that $1,316. One thing to understand about this deductible, unlike most deductibles, this is not annual. This is per occurrence. So if you have to go to the hospital a couple times in a year, you could have a couple of these expenses. And I'll give you an example. My mom in 2014 passed away, and it was in June. That year, up until June when she passed away, she had 5 trips to the hospital. And here's what was going on. She had advanced stages of Alzheimer's. She was in a long-term care facility in the dementia wing. And for some reason, in between 2 and 5 in the morning, she would get up and just walk around. And she wouldn't bother anybody. She would just walk through and I guess, just go on that walk. Well, 5 times she fell, and they found her, and they would call me in between 2 and 5 in the morning and say, Mary fell. Dave, what should we do? My answer was always the same because she was in the final stages of Alzheimer's, so she really couldn't communicate at all. So there was no way to know if she was in pain or if something was hurt. So every time she had to go to the hospital to have an x-ray done and to get checked out. So that was 5 different deductibles that we had to pay that year. Now, luckily, we did have a Medigap supplemental plan that picked up the majority of the cost. We had about a $250 deductible every time she went. So it was manageable, but it was something that many times people think when they see deductible, it's going to be an annual deductible. In this case, it really is a per occurrence deductible. One other thing I want to note on this slide before we move on. If you take a look at skilled nursing and home health care, this is for rehabilitation only. This has nothing to do with a long-term care stay like what my mom needed, where there was care because of dementia. This strictly for rehabilitation. And to qualify for that rehabilitation at a nursing home or for home health care, you have to be admitted as an inpatient at a hospital for at least 3 full days, consecutive 3 full days. If you've been discharged within those 3 days, there is not going to be a chance to be able to go to that skilled nursing or that home health care for the rehabilitation. Many times what a lot of people will do is when they're in the hospital or a loved one is in the hospital, they contact the family physician to make sure the family physician is included, because many times they can manage and make sure that the person is in there as long as they need to be able to make sure that if it is the right situation, they can get that rehabilitation. So what I'd like to do now is I'd like to just go ahead and switch over to Medicare Part B. Medicare Part B is that basic insurance. It covers things like doctor visits. It'll cover things like walkers and wheelchairs. And it also covers things like outpatient procedures. And if you think about what's done today as an outpatient procedure, it's almost everything. And that's going to matter as we go through this slide. So if you take a look at the whole idea when you're looking at Medicare Part B is not going to have been prepaid. So there are actually 3 things that you would have to pay when looking at Medicare Part B. First, you're going to have to look at what you're going to pay on an annual basis. On a monthly basis to have Medicare Part B. But that's going to be based off of your taxes the last time you filed your taxes. And I'll explain that a little bit more in the next slide, but keep in mind that there are 5 different amounts that people will pay for Medicare Part B, and it all depends on their tax returns. So you're going to have your monthly premiums per person. You're going to have an annual deductible this time of $183 per person. And then once you've met your deductible, Medicare is going to cover 80% of the expense, leaving you with 20%. So if you think about it, the idea of going to a doctor's office for a checkup or because you're sick and you want to get well, Say you've already met your deductible for the year. It's a $100 office visit. Medicare covers $80. You cover $20. And that's pretty typical. Here's where it gets a little bit more complicated. When you look at those outpatient procedures, knowing that so many things today are done as an outpatient procedure, that can add a lot of income needs coming back to you if you're not managing this with something like a Medigap Supplemental plan or a Medicare Advantage plan that would do some protection for you on this. One of the things that I found in some of the group meetings that I've done, people on Medicare that have gone in to have a single heart stent put in. I've seen that where that has been done as an outpatient procedure. So to qualify as an outpatient procedure, the rules are you need to be admitted and discharged within a 24-hour time frame. And if that happens, it's considered to be an outpatient procedure. So that would then mean that 20% of that bill would be coming back to you if you don't have a way to be able to cover some of that expense through, like I said, a Medigap supplemental plan or something along the lines of an Advantage plan. Either one can help. And again, which path would make sense for you? A lot of times they both can make sense. It's just a matter of finding which way. But it is always a nice thing to have just to make sure that you're covered, especially for things like this. Once we've gone through the three different topics that you would be charged when it comes to Medicare Part B, the three different ways, a lot of it comes down to, well, what is my monthly premium really going to look like then? Because if it's going to be based off of my tax returns, how do I know what I'm going to pay? So if we could, let's just go to the next slide. And we're going to see that based off of and this is your modified adjusted gross income. What that means is that a lot of the deductions that you're able to take out of your taxes to get to your adjusted gross income get added back in. And that's why it's modified adjusted gross income. So when Medicare is looking at your tax returns, the last time you filed your taxes, they're gonna take a look at if you're an individual or if you're a couple. And if you're a couple filing jointly, you're going to have a modified adjusted gross income between some different levels. And if you're an individual, same thing, it's just a little bit less. You can see that the cost can really vary anywhere from $134 per person per month to over $300 per person per month. Again, all based off of those tax returns. Now, sometimes people end up in a situation where they're not above one of these limits on just an ongoing basis. But there are times that maybe due to somebody passing away and receiving an inheritance, they could be in a situation where they may be pushed to a higher bracket. Another one that we see a lot is people that have land or have something that they sell and there's a large gain on that. Many times that will come back and put them into one of those higher tax brackets. Usually it's only for 1 year, but many times if you're not prepared for it, it can be very surprising to see that increase. Now, if it is a one-time type of thing, so it's not going to be your income level going forward, one thing that you can do is you can actually petition Medicare and say, this was a one-time situation. This is not going to be ongoing. This is not my new modified adjusted gross income level. My normal modified adjusted gross income level is or has been, and show that based off of past years. And what you can do many times is be able to get your Medicare Part B premium reduced to what it should be, meaning that they would disregard that one-time situation like an inheritance. Sometimes it does work, sometimes it does not. One last thing here with Medicare Part B before we move on to the other topics with Medicare. Medicare Part B for most people will be paid directly from Social Security. So when you look at what you're going to receive from Social Security on a statement, so if you're eligible for Social Security, you receive those statements or have a chance to go online and look those statements up, that number is showing you a number without having Medicare coming out. So if you're going to have 1 or 2 Medicare Part B premiums paid, keep in mind that that's going to be coming out of your Social Security check before you receive it, and it will be reducing that amount that you're going to be receiving on a monthly basis. So it's a nice side note, but that will provide you some protection that I'm going to talk about here in just a couple minutes. When you take a look at Medicare Part D, pharmaceutical plans, these plans will differ county to county across the U.S. in coverage, availability, and cost. They will change on an annual basis. These plans, when you're looking to sign up for them, it can be very challenging if you have multiple plans in your area to figure out which one may make the most sense. What I found, and this is something that I used to do with my dad, is we would go to our pharmacy, and we had a CVS and a Walgreens. We would end up going to those two and taking the prescriptions that they were currently taking, and the two pharmacy companies would help us understand which of the plans would make the most sense for my parents for that year. So it was a nice free service that they provided, and obviously they're hoping that we would get the prescriptions filled there, and we did. But it was a nice way of them being able to help us be able to make those right choices. And to them, it didn't matter which one we purchased, so they weren't trying to just have us purchase a plan because that's the plan they have to sell, because they didn't have any plans to sell. It was just a nice thing that they could provide to us. So this is a good a time as any to talk a little bit about Nationwide for just a second. One of the times, or a lot of the time when we do this presentation, people think that we're doing this presentation because we have health insurance to sell. I just want to let you know Nationwide does not sell health insurance through anything as far as people that are working. So we don't have any corporate plans, we don't have any plans for companies, and we don't have any plans for people in retirement through Medicare. So we don't offer any of these types of plans that we've been talking about. As Matt had said early on, this is really just an education. That's all it is. We know that this is one of the largest expenses that people face. Many times there are misunderstandings on how it works, and we just want to clear that up the best that we can. So Matt, if we could, let's just go on to the next slide. And you can click again, and one more time. Perfect. Thank you very much. We've all heard about the donut hole. At least most of us have. The donut hole is something that will come in, and it will be around at least for a couple more years, and I'll explain what I mean by that in just a minute. But you've now selected your Medicare Part D plan. What's going to happen is you're going to have a deductible. In this case, it's a $310 deductible. Then you're going to have some cost sharing. And what that is that means the insurance company is going to be picking up some of the bill, and you're still going to have a little bit of bill through those copays. So what you do is you take a look at your deductible and the Medicare benefit, the initial charge or coverage at 75%. To that line, it's about $3,000 of total drug expense. Of that, you would have paid almost $1,000, and the insurance company would have paid almost $2,000. What happens if you need more pharmaceuticals than that? Currently, there's this thing called the donut hole. And what that means is that the insurance company is not going to have any responsibility for a period of time. And that period of time is a total cost of about $3,720. That means that you would take on that expense. And once you got to the other side of the donut hole, which is a total drug expense of about $7,000, of which you've paid about $4,700, the insurance company will kick back in with this idea of catastrophic coverage, and they will cover 95% of the medication bill. So I say this is how it is today. Well, the great thing is that under the Affordable Health Care Act, which I know could be changing, but as it stands right now, it has not been changed, the donut hole is scheduled to close by the end of 2020, and they have actively been making it a little bit smaller and a little bit smaller through the years. So if things continue as planned, you will see the donut hole close by the end of 2020. So if we could, let's just go ahead and go on to the next slide. One last thing I want to do before we get down to talk a little bit about the overall expense. It's to talk about the Medigap supplemental plans. like I said, there are 10 plans. They are identical, state to state, county to county, across the U.S. and what they cover, but the cost will change. It will change county to county. Some of these plans are very inexpensive on a monthly basis, but they're more of a high deductible plan, meaning that you're going to have a high deductible that you're going to have to pay before the insurance company will come in and provide help with the bills. Some of the plans are very comprehensive and will pay a lot of the co-pays and deductibles for Medicare Part A and Medicare Part B, alleviating that pressure on you. Deciding if this is the way you want to go and which of the 10 plans you would want to take a look at. There's a book that is on the Medicare website called Medicare and You 2017. In October, they will release the Medicare and You 2018 book. But in that book, you will see a breakdown of each one of the plans on a comparison. And you will see what's covered, what's not covered, what the deductibles are, the co-pays, what you're responsible for, and what the plans would cover. So that is a very good place to start. And then that SHIP office that I talked a little bit about is another good way to really kind of narrow in on what you're looking to purchase. If we could, I do want to start totaling a couple things up for you. So Medicare Part A doesn't cost a dime to have as long as you have gone out and you've prepaid for those premiums for at least 10 years. Medicare Part B could actually be a little less than what I showed you on that last that Medicare screen. I know I showed you a number of $134 per person per month. Here you're seeing a number of $104.90. So why is there a difference? Well, remember when I said Medicare Part B premiums are paid for directly from Social Security for most people here in the U.S.? What ends up happening is there's this provision in Social Security and in Medicare referred to as hold harmless. And what that means is that is protection for you from inflation when it comes to Medicare Part B premiums. So over the past couple years, we have gotten very little in the way of cost of living adjustments with Social Security. So if you would have actually signed up for Medicare years ago and had those premiums being paid for by Social Security, what would happen is even though there has been inflation over the past couple years, bringing that number up now to $134 per person per month, you're actually held to a lower number because of the protection that hold harmless brings, because there really has not been a cost of living adjustment for you when it comes down to Social Security. So it's just a nice little protection in there to keep you from losing purchasing power because of Medicare Part B premiums going up. Medicare Part D, the average is right around $40 per person per month, and now that's nationally. It's obviously going to change county to county, but looking nationally, that's what we're finding is the average cost. And then the Medigap policy, the plan that we have seen used the most over the past couple of years is Plan C. It's very comprehensive. It takes away the majority of the co-pays and deductibles, and its average is right around $185 per person per month. So if you total all that up, what you're going to find is about $4,000 for an individual, about $8,000 for a couple, and that's just going to be to have the full coverage under that option one under Medicare, and it's going to cover the premiums, but it's not talking really about utilizing anything with the coverage that you have. So if we could, we're just going to go on to the next slide, and one of the things we want to do is we want to be able to provide some resources and some help. I know Matt has done quite a few meetings one-on-one and in groups around healthcare and some of the different services that we have like Social Security, and also we really do want to be there to have good conversations with you, find out what kind of coverage you may have, and then figure out what healthcare could look like for you. And that takes us really to the next and final topic that we're going to talk about today. We have a healthcare cost assessment that we created for people exactly like you that want to look at what healthcare costs may be as they retire, not for the average, but for them, specific to where they live, how they live, what their lifestyle is like as far as their health, what their saving situation is, because all of that will play in. So what I'd like to do over the next couple slides is give you an idea on this healthcare cost assessment. So you can run one of these. There is no charge to do it for you. And what this will do is it will actually come back and it will show you a good rundown on what healthcare costs can look like for you. So the page that I utilize the most is this one right here, and it will actually go year by year showing you what healthcare costs will be for you or for you and a spouse, and it will show you a couple different pieces of information. So if we could, let's go ahead and click, and one more time, please. Thank you. What that's going to show you is that's going to show you year by year what this couple can expect to have as far as a healthcare cost. So the Medicare Part B premiums, it gives you an idea of what each person would be paying for there. Medicare Part D and a supplement, if you choose to have that, will show you the same thing there as well. Additional cost, that really comes down to the pharmaceutical drugs that you're taking and any kind of copay that you would have for the year. It also includes other types of medications that we all take on a semi-regular basis, things like antacids and things like painkiller, like a Tylenol or an Advil, things along those lines. Those get totaled in as well. And you see that in our case for John and Jane, we've got the information there. But on the far right, you see a green area where it talks about household total and then household total without Medicare Part B. These are the two numbers that we use when we start looking at what healthcare costs could be specific to you. And when we're looking at this, we get an idea of what that first year total cost would be, and then we get an idea of what that expense that we would have to make up outside of our Social Security, what that would look like as well. So the $11,000 is what this couple can expect to pay for their health care all in for that first year, and in this case it's 2019. But what they're really going to have to come up with as far as income throughout the year above what's already going to be coming out of Social Security is around $7,600. And you can see this every year all the way through their life expectancy. And if we can click one more time, I'll show you one of the most important things on this entire assessment. On the far right-hand side, you're going to see two numbers. One is 19,000 and one is 14,000. Those are the averages. So the average overall cost for this couple is almost 20,000, but the amount that they're going to have to come up with on an annual basis is close to 14. Now, one thing I can guarantee you is these are not your numbers. Your numbers will differ based off of where you live, your health, your savings, all of that, your age, when you're going to retire. All of that is very unique to you, and that will basically change this report entirely. So if we could, I'll show you how you can run one of these reports, and we'll just go ahead and show you. There's a one-page form that we have, and we have different ways that we can get this to you. But what it is that you fill your information out at the top, you let us know where you would like the assessment sent, and that's the email, and we will email you a copy of this assessment directly to you. A lot of people like to have it sent just to a personal email, so it's only seen really by them. So we have a lot of people that do that. We do ask that you sign, just saying that you do want to have this run. What you'll find is that the only thing that we need from here on is just your name. Then we look at the things that are going to change your health care costs, things like gender, current age, retirement age, your city and your state, and to get an idea of what that's going to cost for the geographic and the county type of situation. If we can go ahead and go on to the next slide, you're going to see that we're asking some very basic questions when it comes down to health conditions. Have you ever been diagnosed with things like high blood pressure? Yes or no? We don't need your numbers, but we just need to know yes or no. These are the things that will sway the cost when you're looking at healthcare, and it also will determine a lot around the idea of life expectancy and longevity to see how long people like you will be living in retirement. It's a very nice thing to have to be able to start doing some more in-depth planning when it comes down to retirement and retirement income. You can see, again, the questions are pretty basic, and if we go on to the next slide, what you're going to see here is where we're looking at what you believe your tax situation will be in retirement. So if you're going to be filing jointly, if you're a couple filing separately, or an individual. if you get an idea of where your tax bracket will be for that modified adjusted gross income, you can check that, and that will make sure that that includes the right Medicare Part B premium for you. Now, one thing is, if you think that you may be borderline between two different numbers, I always encourage you to check them both, because that will be able to help you be able to see the importance of managing that taxable situation. One last thing to take a look at, and we're opening it up for any questions that you all have, but if you take a look here, and you're looking at how you would like us to run this report, it gives you a very good idea here where the first box at the very top is going to be the one that shows you the highest dollar amount, so the largest expense. And the reason is it's going to include things like Medicare Part A, Medicare Part B, Medicare Part D, a gap supplemental plan, and all out-of-pocket expenses that you can expect to have. The next one would show you the same information, but it's not going to include out-of-pockets for things like your pharmaceuticals. The next one down will just show you what it would cost to have Medicare Part A, B, and D, and not have any kind of supplemental insurance. We find some people, especially if they're looking at something with like a gap, instead of a gap supplemental plan, they're looking at a plan that they're getting through the Advantage side. A lot of times they would choose this and then just add in whatever their Advantage plan looks like for them. And then the last one, this is where things like TRICARE for Life will come in. So those that have served our country, excuse me, when it comes down to military service, many times your only expense will be things like Medicare Part A and Medicare Part B. So we have 4 different ways we can run this. The one at the very top will show the largest dollar amount. The one at the very bottom shows the least expense. So what I'm going to ask is that, first off, do we have any questions? Has anything come in, Rachel?
Not yet, nope.
Okay, great. Well, I'll tell you what, if anybody does have any questions, feel free to go out and take a look. We have all kinds of different things that we can provide. We obviously can do the presentation that we've done here today. We can provide that fact finder to you as well. And then we also have some resources that can come out with that assessment that is a kit of information on healthcare and long-term care, giving you an idea of expense. Once again, we don't sell the products when it comes to healthcare. It really is just a resource for your information. So I'm going to go ahead. I'm going to turn it back over to Matt. And if any questions come in, I'll be happy to do my best to address them.
Thanks again, Dave, for taking your time today. And if you hadn't realized, Dave was calling in to our presentation, working with us. And I just kind of want to piggyback on in his final remarks that if you'd like to have any of the information provided today, whether it's the presentation, the healthcare flyer, I can provide that to you to be emailed to your employees or maybe included with your pay stubs on a week. Or if you just like the assessment to be able to run through that yourself or have any employees run through that, feel free to get a hold of me. My information is on the, I believe it's on the ISAC website as an endorsement partner. But for today, you can contact me directly by my cell phone, and that's 515-218-0303, or you can email me at ring, R-I-N-G-M for Matt, and the numeral 3 at nationwide.com. I can provide you with the flyer and the fact finder, or if you're having say, healthcare benefit fairs or wellness fairs at your counties, or maybe in partnership with several counties, we can try and have it scheduled for Dave to come out and provide the presentation to all of your employees as well. And that's really all I had. Have there any questions come in at all? Okay, if you have any questions after the presentation, again, feel free to email me and I can provide the question on to Dave. And you'll notice there on the flyer, it is a little small, but there's an 800 number you can dial as well. So we appreciate your time. This has been another great partnership here with Nationwide, NACO, and ISAC, and we hope you all enjoy the rest of your week. Thanks.
And I will just say thank you again for attending. This webinar will be available on the ISAC website. If you go to the tab Meeting and Events, webinar is the final item in that list. And then we will make the recording of this webinar and also the presentation available. So you can go back and watch it at any time or share it with any of your employees as well. Thank you for attending again, and feel free to contact us with any questions.